So in April of 2020, the Indian Ministry of Health and Family Welfare released a COVID containment plan that included a really detailed information plan, had a mass communication strategy with SMS, social media, radio, television, had help desk, it had regular government press briefings. Concurrently, journalists across India played their role in translating the evolving science for a really health illiterate population. And so the most exciting part, though, that this information was amplified by a network of 2 million rural health workers who, again, were getting that message out there. And the results of this campaign in India were really clear. In November 2020, they conducted a national survey and found that 87% of Indians were willing to take the COVID-19 vaccine when it became available. That's all fantastic. In January, a little bit of a trouble hit as the indigenously produced vaccines were being rolled out. The government used some confusing language. They talked about a clinical trial mode, and there was some mixed information about vaccine efficacy, which started to cause an uproar in the scientific community. And that uproar, needless to say, quickly moved into the popular media, and they started really covering stories that questioned vaccine development and the approval process. So despite months of a really beautifully unified COVID-19 message, the uncoordinated and somewhat chaotic public introduction of the vaccines put the incredibly massive vaccine effort, perhaps the largest the world will ever see, at risk. So I don't want to end on a dark note with that story, because the good news is recently India has moved back from vaccine hesitancy to vaccine demand over the last 2 weeks. Part of it terribly is because of the rise in infections, but the medical community really took to the airwaves and 24/7 talking about the vaccines, talking about the resurgence in English and all the local languages, and they've really been able to bring India back on track, and the world should be grateful for that. But I think the case of India really reinforces a really hard lesson that building trust in such a sensitive issue as COVID-19 requires significant sustained work, but losing trust is sadly really, really simple. So we need to really think through the lessons about how we best communicate in the pandemic.